Hi, everyone. My name is Dr. Deanne Mraz Robinson. I'm a board-certified and fellowship-trained cosmetic dermatologist. I'm currently the director of the Body Sculpting Center at Connecticut Dermatology Group and a clinical instructor of dermatology at Yale New Haven Hospital. I'm really excited to share with you today some of the work that I've done with ALASTIN, utilizing their procedure enhancement system in a clinical trial, and we'll go through that data. So, study. We looked at 10 patients in a comparative split face or split décolleté, investigator-blinded, randomized study. So what we did was 2 weeks prior to their non-ablative fractional resurfacing, patients were started on the ALASTIN procedure enhancement system on one side of the face or décolleté, and on the other side of the face or décolleté, they were started with the basic regimen 2 times daily. Subjects then underwent fractional, non-ablative, thulium-duped 1927 nanometer Fraxel dual laser therapy to their entire face or décolleté. Immediately following the laser procedure, patients were again treated with one side of the face with the ALASTIN procedure enhancement system, and to the other side of the face, the standard regimen, and that was applied by a non-blinded coordinator. The subjects were seen postoperatively days 2, 4, and 14 and continued their regimen of the procedure enhancement system and basic regimen to the respective sides of the face or décolleté. So what did we see? In terms of the ALASTIN procedure enhancement system, we found that healing was statistically superior to the basic regimen by day 4. So when we looked at a 5-point standardized healing assessment scale from 0 to 4, patients and subjects found that with the procedure enhancement system, healing was statistically improved comparatively to the basic regimen. Additionally, if we looked at factors such as improvement of lentiginous, texture, and global photo damage by day 4, it was also found statistically that investigator-assessed change in the severity of photo damage versus baseline of lentiginous, texture, and overall global tone and texture of the skin was statistically improved comparatively to the basic regimen. Also, patients felt and looked better with the ALASTIN procedure enhancement system. So when we asked patients on day 4 what side of their skin feels better and what side of their skin looks better, they found and stated that the procedure enhancement system with ALASTIN was better than the basic regimen. Here are examples of patients at day 4 healing after the thulium-duped 1927 procedure. So you can see on the left side of this gentleman's face, this was the side which he pre-treated with the ALASTIN procedure enhancement system and then treated post-operatively to day 14 with the enhancement system, comparatively to the right side of the face where he utilized the basic regimen of Aquaphor, CeraVe, and Vanicream. And what I hope you can notice is on the left side of the face, on the ALASTIN procedure enhancement system side, his skin texture is smooth. There's marked clearing of his lentiginous. There's minimal erythema, minimal edema. And then on the standard protocol side, you can see still the remnants of some gritty lentiginous that are, kind of on the way to clearing. There's some definite edema and erythema. And I believe, and the patient also believed, the overall look and the texture of the skin on the procedure enhancement side was superior to the Aquaphor basic side. Another woman who, again, same protocol in terms of the ALASTIN enhancement system comparatively to the basic regimen. And what I hope you can find in her photos is that, again, on the basic side, lots of edema, lots of erythema, lots of scattered lentiginous, a rough tone and texture of the skin, and comparatively to the ALASTIN procedure enhancement side, marked clearance of the lentiginous, much smoother texture and tone, and much less erythema and edema. So in terms of how I utilize ALASTIN in my clinical practice, there's questions that practitioners ask me on a basis, and I'd like to go over a few of those with you. So in terms of what procedures do I utilize the ALASTIN procedure enhancement system or products, I utilize them in a wide variety of procedures. Definitely all of my ablative or non-ablative fractional resurfacing patients, I love to utilize the procedure enhancement system. It's so important to clear the ECM, clear the matrix of that solar soup, as I call it, the glycosylated end products, the collagen that's just not working properly, all of the byproducts of free radical damage, of oxidative stress, of UV damage. And that's really setting the tone to allow the skin to regenerate the collagen elastin, not only with the elastin products, but also with the procedure that we're going to do for the patient. So pre-treating the patients prior to these procedures is really key. So I will utilize it for non-ablative, ablative resurfacing. I will utilize the nectar for microneedling, either cold microneedling or RF insertional microneedling. I'll utilize it for procedures such as picotoning, in which the patients are having some erythema and edema afterwards and really want to enhance their results and minimize their downtime. Depending on the ablative versus the non-ablative treatments, it also kind of depends on the timeline in which we catch these patients. So a lot of times for ablative resurfacing treatment, we're going to see the patient in consultation, get them ready for the risks, benefits, downtime, etc. So we have the luxury of these patients to pre-treat them for the 2 weeks prior with the procedure enhancement system. Similarly, at times we have that luxury with the non-ablative resurfacing procedures as well. But sometimes patients are in the office ready to have the procedure done that day. And in that case, I will not pre-treat them for the 2 weeks for the procedure enhancement system, but have them purchase the kit and utilize it through the series of the non-ablative resurfacing treatments that we do. So in some regard, they'll be pre-treating for the next in the series. And the way that I incorporate kind of the pre-treatment phase, the regenerative procedures is, again, for some of the non-ablative cases, I will pre-treat them for 2 weeks prior to their treatment series. But in some cases, I will do their non-ablative resurfacing that day and then post-operatively follow with the procedure enhancement system and have them pre-treat for the next in the series, be it 1 month, 6 weeks later. But for the non-ablative resurfacing patients, I really do want to optimize their outcome and minimize their downtime, so I will pre-treat them for the 2 weeks with a procedure enhancement system prior to their procedure. I have received absolutely wonderful feedback from my patients with the procedure enhancement system. The subjects who underwent my study could not wait to have this product in their hands. So the patients who had the thulium dupe procedure the procedure with the procedure enhancement system absolutely loved it. But also in clinical practice, my patients absolutely love the nectar. They also really, really love the restorative skin complex. A lot of patients come in and, in a total body skin exam or in a general consultation are asking me, what can I do to promote the health in my skin and really help promote a healthy skin environment. And for those patients who aren't procedural ready but are looking to do something, I usually start them on the restorative skin complex, which really sets the stage that if down the road that they're thinking about doing, non-ablative or ablative resurfacing or, picotoning or IPL, that they're going to want to utilize the nectar because they really believe in the system and they really believe in the products. In terms of my ablative resurfacing, I usually package the system into the price for their procedure. Again, I want to enhance my patient experience and maximize it to the full degree as possible, and I really want them to have the best outcome as able. So, in those patients, I really stress that this is the way we're going to do it. We're going to use this system. This is part of the package that we're doing. In terms of the series of non-ablative fractional resurfacing or RF or microneedling, I will have the patient purchase it separately. Then again, just really stressing the enhancement of the results and the diminishment of the downtime. I personally absolutely love the ALASTIN skincare system. I use the restorative skin complex. I utilize the nectar peri-procedurally. I also really love the UV protection with the mineral block, and I really talk about that with my patients. I'm a believer of practice what we preach, so I utilize these products personally, and I tell them why, and I believe that my patients have really experienced great results and have really loved these products. The way that I explain the technology and the activity of the ALASTIN series is I kind of basically explain the tri-hex proprietary peptide technology and talk to them about clearing out that ECM, clearing out the matrix, getting rid of that solar soup, getting rid of the glycosylated end products. So again, we can set the stage for new growth of collagen and new growth of elastin in a meaningful way. So let's clear out the garbage from the past years of sun damage, UV stress, radiation, all of those things, and get the skin maximized and prepped to build our own collagen and our own elastin fibers, which is very meaningful. I hope that you found our helpful, and again, I thank you so much for your attention.